So you do a lot of wisdom teeth. In fact, I jokingly said you're the king of wisdom teeth.
Yes, thanks. I'm actually the founder of the Extraction Academy. Normally this procedure is done by oral surgeons.
All right.
But I realized there was a lot of volume of patients in my practice that needed this type of treatment. Ideally, we like doing wisdom teeth between the age of 16 to 21, where the bone is still quite soft. But we have had patients in their 60s and 70s where we found indications for removing the wisdom teeth. See, Randy, wisdom teeth, there's a little bit of debate about when they should come out and why they should come out. It's very prudent to have a justification why they are coming out. So if the patient has anterior crowding and shifting caused by them, that's one indication.
So when you're 18, 19 years old and you get your wisdom teeth out, or 17 or whatever age it is, what age do you recommend?
I recommend the best age is about 17 years to remove your wisdom teeth.
And if you don't remove them, the teeth are going to get crooked? Is that
They
why?
start pushing on the teeth because it's one human deficiency that we have. Whoever designed our body forgot to leave a little extra space for us in the wisdom teeth area. Okay. So they cause a lot of problems. They become a food trap. They start affecting the teeth in front of it, which is the second molar, and at times they end up causing cavities there. And the patient comes in with a cavity on a second molar as a 30-year-old, and it's very unfortunate because they lose both of the teeth. They lose the wisdom tooth and they lose the tooth in front of it because we can't do anything for them. The roots are compromised under the bone. Okay. So then you have the option of having multiple procedures done and still have a poor prognosis to save the tooth. So the patient loses both teeth. So another factor is if they're not in the bite, if the patient is not using the wisdom teeth in their bite, it's actually a bacterial trap. A lot of functions in our body is sort of goes based on the concept of use it or lose it. So now you have a tooth back there that you're not using and you can't really clean because you can't get back there very well. We can barely get back there as dentists.
Okay.
So I recommend everyone to have the evaluation done at a young age to have their wisdom teeth removed, unless the only time I don't touch them is when they're perfectly in the bite, patient can clean them, patient has no complaints, there's no shifting going on.
Okay. Now the oral surgeon normally does the wisdom teeth. So you've had extra training, and are you less expensive?
I'm less expensive, and I like to think I'm faster than most oral surgeons.
Okay.
But speed is very important for patients. Patients don't like to be in the chair for 2 hours while you're setting up your IV sedation and stuff, and then take your time with the wisdom teeth. Patients want to get in and get out. And I have sort of established after 10 years of doing these procedures on a daily basis, a method of doing it much faster, much quicker, with the least amount of trauma, to a point where it doesn't become such a horror story for my patients. It has certainly succeeded because I continue to do them more and more and getting the same results.